Hi, so the first video that I wanted to do in detail was about pain. So pain is something that's very personal to me. Pain is by far one of my biggest symptoms. I started getting major pain around 2012. It was almost as if one day I woke up and I didn't realise that pretty much for the rest of my life I was always going to be in pain 24/7, which people don't understand if it's not something they are also going through. It's quite hard to tell someone that I do not remember what it's like to not be in pain. So over the years I've learned some things, I've learned to manage it a little bit, so I thought that I could create a video for other people suffering with chronic pain, whether it be fibromyalgia or hypermobile EDS like I have, just so we can all kind of help each other and learn some things together. So I personally have hypermobile EDS. And there's a quote from a Dr. Forrest Tennant. And he says, "At this point in time, I put EDS in the category of being in the top 3 or 4 most severe pain problems. A lot of people, for example, think that cancer pain is the worst pain. But let me assure you that many EDS patients have pain far beyond any cancer patient I've ever seen. And so it's one of the pain problems that is severe. It's been very troublesome. Many physicians are afraid of the disease and of the kind of pain that EDS patients have." So Dr. Forrest Tennant is a pain management doctor from California. And I think to me that highlights the fact that people, I think, underestimate a lot of the pain that we have and that we go through. And I think occasionally you might meet the odd doctor that actually says hypermobility doesn't cause pain. And that to me is absurd, because we know it causes pain, a lot of us suffer pain, and so quite often when we find that doctors are sometimes unwilling to help us, that we really become quite desperate and try and find other ideas. So that is the premise of why I'm doing this video, is to help other people who really have nowhere else to turn. I'm going to split this video into 2 parts. So I'm doing a non-medication part to start with, so things that you can do that don't involve taking medicine. And then my second part is going to be about medicine that you can take, so painkillers that you can take. Because I've actually responded to a couple of people already who have said, "Oh, my doctor says there's no pain medication out there that can help me, there's nothing they can do." And that, quite frankly, is a straight up lie. That is not the fact. They're obviously just not willing to take the time to go through these options with you, and that's not fair. Obviously, like I stated in my first video, I'm not a doctor, I don't work in the medical profession, I am a patient myself, so all of these ideas, especially the medicine ones, you need to talk through with a qualified doctor, you need to go through things with a doctor as well. When you're going on and off medication, it needs to be watched and monitored very, very carefully. So, especially in the medicine part, just because I'm mentioning medication does not mean automatically that it's safe for you to take. So obviously it's taking ideas that I'm giving you and working with them. For example, I am actually allergic to codeine and morphine, and marijuana. So I have had my own struggles about trying to find the right things that fit and going through things like withdrawal and allergic reactions, and it's something I have to do very closely monitored, and I've been lucky enough to have some fantastic doctors to do that with me. So I hope that you can find doctors that do the same. So this first section of the video is going to be on non-medication ways to help manage your pain. So things that don't involve prescriptions and medicines from doctors that you can do, hopefully in your own home, and hopefully will help reduce and manage your pain just a little bit. So the first thing that I am going to mention is pacing. Now, pacing is one of those things where, if like me, you've been to many group support kind of meetings, especially in the UK with the NHS, they love sending you to group sessions. And one of the things they always say and come out with is pacing and exercise. And sometimes you are left a little frustrated because they don't really mention anything else. So when someone else mentions pacing, you just want to throw the workbook at them, because it's like, okay, are you actually not going to give me anything useful? So don't worry, I have been there. But over the years, I have discovered kind of that pacing is something that you can use to help manage your pain. It's obviously not the only thing. There are other things that can help that process as well. But it is obviously interesting to see what your limits are and learn to read your body. So pacing is the idea that we get stuck in a very boom and bust cycle. So when we're feeling good, when we're feeling, oh, this is a good day, I'm not in much pain, we go out and we do as much as we can, whether it be going out with friends, taking the kids to the park, tidying the entire house because you haven't tidied it in so long, and you're like, right, now's my chance, I've got to do it. And it's all right at the time. You might go to bed and think, oh, that's okay, I'm not too bad, I'm not in too much pain. And then 24 hours later, you completely drop. You've done too much, your body hurts way more than it did, and you realise that even though at the time you weren't paying for the amount of activity you were doing, actually there was a cost, it just hadn't happened immediately. This is what they call the boom and bust cycle, and this is where the idea of pacing comes into it. So my general rule for myself, and I do find it incredibly hard, I struggle not to do everything that I can when I'm well, and so like if there's a hill to walk up, I should probably only walk up half the hill, but mentally I have an issue of walking up half hill, so I'm going to walk to the top no matter what. So I understand that for a lot of people this is more difficult than it just sounds. So my primary advice is take what you think you can do and actually only do half of it. Sounds simple, but I know obviously in reality it's a lot harder to do, especially mentally if over the years you've become wired to always going above and beyond, always going the extra mile. It's quite a mentally challenging thing to actually go, you know what, I've only cleaned half the house. Physically I feel like I could clean the whole house, but I'm going to stop here because I know that it's best for my body and I need to not judge myself for that. So that in essence is the idea of pacing, that hopefully trying to find a more stabilised level of activity will hopefully stop the rapid incline and decline of the levels of pain that you go through. That's the first one. The second one, again, is very similar to pacing. It's something that I'm sure you've heard time and time again, but it's not really been explained properly, and it's something that initially gets quite a few people's backs up, and that is exercise. You quite often find that it's the only thing the doctors will say to you, oh, you need to go exercise, you need to increase your activity, and it's so much more than that, and it's quite a psychologically difficult issue to deal with for so many of us, because either we haven't been doing it right or we haven't understood that maybe when they say exercise, they don't necessarily mean to go out a 20-minute run. It might literally be, for you that day, your exercise is walking down the stairs. So again, it's something that I know, along with pacing, saying exercise puts a lot of people's backs up, so just bear with me, okay? So I used to be quite a sporty person. Actually, I was a very sporty person. Then obviously I became very ill in my teenage years. All of a sudden couldn't do anything. And I was originally diagnosed with fibromyalgia. Well, it was ME, then fibromyalgia, then EDS. And so all I knew was that if I did too much, my body hurt. So when people said you need to exercise more, to me it did not make any sense. Now, when I was further diagnosed with hypermobile Ehlers-Danlos syndrome, the way the doctor explained it to me was because our joints are hypermobile, the muscles around our joints work overtime to try and support our joints so that they stay in position, which in return basically is causing your muscular pain, because your ligaments around your knee, which are meant to be keeping your knee stable and secure, aren't working. So your muscles are like constantly just working, trying to keep your knee where it's supposed to be. And so the idea is that the stronger that your muscles are, the easier it is to support your joints. And so in theory, your pain should become reduced. I say should because this is an idea that was introduced to me at the start of the year. And my doctor did admit, he said it can take anywhere up to an entire year of focused physiotherapy to actually see a potential decrease in pain. This is not something that's going to happen overnight. This is not something that's going to occur in 2 to 3 months. This is sustained, constant working at the muscles, because your body has degenerated to such a condition that it just can't do it anymore. And so a lot of people are put onto physios, hydrotherapy, things like that. I'm going to do an entirely separate video based on exercise and physio around chronic pain and hypermobility, because it's such a big topic. But all I would say is start low, go slow. Okay, that sounds really cliche, but it sounds cliche, but it is true. You know, my physio started, I was lying flat on my back on the bed, and my exercises were me lying down on a bed. And then, you know, it will take maybe even a couple of months to progress to actually sitting up in bed and doing your exercises. So this doesn't mean you need to go out and you need to start lifting weights right away. That could potentially cause more damage. But it's understanding that when doctors say exercise, it's varying levels of exercise. So walking down the stairs is exercise, it is activity. So congratulate yourself if that is something that you can do or something you're able to achieve. So don't mentally be like, oh, I've got to go for a run. Because I tried it, I thought I'd be like, oh, let's see how much improvement I've got. Can't run more than 150 metres. So yeah, that's certainly not something for me. So that is my second idea. Okay, so number 3, I am going to talk about massage. Now, massage is something that, again, some people really like, some people really hate. These are all things that are varied to person. So basically what helps some people may not help others, so it's all about trying to find what works best for you. I personally adore massage. Now, it really hurts at the time, I'm not going to lie. At the time of getting the massage, it is certainly not a relaxing experience. It hurts, and it hurts bad. However, I deem it worth it because in the long term, it actually massively reduces the pain that my muscles are in. So it's taking that little bit of pain at the time to try and improve, in general, the quality of pain reduction. So, and the more frequently I have it, the less painful it is. So it's kind of like easing my body and easing my muscles into a better state. There are different massages that people do. So you've got things like hot stone, deep tissue, if that's something that you like and you really like someone getting in there and trying to get all the knots out of your muscles. Or if that scares you and you're like, oh, I don't like the sound of that, maybe just starting something light, just something kind of relaxing, just to see what it's like, obviously, on your skin. Some people like aromatherapy, so involving the oils and the relaxation side of things. Alongside massage, you obviously have acupuncture. So acupuncture, reflexology, so these things that kind of are involved to directly impact your muscles and relax them. So reflexology, if you don't know, is more focused around the feet. So it's the idea that there are trigger points in your feet that relate to different parts of your body. And so relaxing these trigger points and kind of getting the movement and the circulation helps all around the body. And it might be a good idea, if you're worried about massage, to maybe just start with your feet. Just start with reflexology and then go from there. I personally have a massage known as fascia massage. So the fascia is basically a sheet of connective tissue beneath the skin, okay? It's primarily made out of collagen. So those of you will recognise collagen as the primary defect genetically that we struggle with. So it's primarily made out of collagen, and it basically attaches, stabilises and surrounds all your muscles and all your internal organs. It's like a spider's web under your skin. It kind of connects to everything. And so again, you have there's fascia points which often relate to, for example, your fibromyalgia trigger points. And so I have a focused massage on loosening up the fascia and the collagen around the muscles, which then allows my muscles to relax in turn, and it just kind of gets everything circulatory working a bit smoother and in general kind of relaxed and calm. But again, this may not be for you. It may be for you because it might hurt a lot at the time, and it may be something that you don't want to go through, which is completely understandable. So it's completely different for everybody. But for me, it's 100% worth it. So I don't know if you've tried something like massage or reflexology, but that is some advice that I would give you. Acupuncture is obviously the one with needles, so they insert needles into trigger points. So obviously, if you do not like needles, I wouldn't suggest acupuncture. But a lot of people use acupuncture and have had really fantastic results and find it really helpful. So that is my next group of tips. So you've got your massage, your acupuncture, your reflexology. So maybe think about giving them a go. Number 4 ties in very well with massage and actually exercise as well, and this is stretching. So again, this is something that I would say needs to be done with care. You may think that actually it's not a good idea for you, but you never know. So when I say stretching, I mean lightly and loosely, kind of making sure that your muscles are stretched and loosened out. However, with hypermobility, the issue with stretching, and this is why actually yoga is often not recommended, is because we quite often have a poor sense of where our joints are. So completely by accident, we end up hyperextending and overextending our joints, which can lead to more injuries. So when I say stretching, obviously please do this with care. If you can, have some guidance with it. Some people have done yoga before they were ill, so that's something that they stick with, and that's great. If it's not something you've ever done, then just normal stretching, just reaching up as high as you can, or reaching up as wide as you can when you're lying down, that kind of thing. It doesn't have to be hardcore stretching. Maybe just trying to get a little bit of movement going, especially if you are really sedentary or bedbound, for example. I went through a phase where I was bedbound, and obviously there's not much you can do exercise-wise, so maybe just stretching out occasionally, you might find some relief. So number 5 focuses on the idea of hot and cold. So normally you fit into one or the other. So for example, I love heat. I love it when it's hot. Hot and dry is like my favourite thing. Some people, on the other hand, really detest the hot and feel massively better when it comes to the cold. So I would advise trying to figure out which one works for you. I would say you will know quite quickly, just by either writing it down just to change an outside weather, or just a quick test. I would say your body will tell you pretty quickly which one it prefers. So there are things that you can kind of embrace about hot and cold. So these things are things like heat packs. So you can get things on Amazon. So these could be heat packs that you put in the microwave, or cold packs that you put in the freezer. And then what you do is you put them into like a pouch, and then you can strap it to parts of your body. I had a great heat pouch thing that I used to wear to college. So I would strap it to my back and go into college, and it would just provide kind of comfort for a couple of hours, which was great. You also get things like hot mats, cold mats, so things that you can heat up and then lie on, or cool down and then lie on. Obviously with heat you'll get things like electric blankets that you can put into your bed, and really fancy ones have like timers and stuff, if you're really fortunate, that might turn on, for example, in the morning when you're really stiff. Or it might just be used when and where you really need it. Things like gels, so you get like BioFreeze and there's a really famous heat one, but I can't remember. Deep heat, that's the one. Again, I can personally only use deep heat on my back because I use really powerful ones. So it's actually, I'm too sensitive to use it on other parts of my body, it burns too bad. But for example, on my back, it's great. So pretty much anything that gives me warmth is something that I look to get. So I would recommend trying to figure out kind of what works for you. Obviously, if you can't afford to buy things, which obviously is sometimes the case, then there are cheap versions. So you've got things like hot water bottles, or just an ice pack, or a bag of peas from the freezer in a tea towel, and just kind of using that and figuring out what works best for you, whether it's hot, whether it's cold. Again, other ideas that evolve around heat are things like baths. A lot of people with things like heads and fibromyalgia also have something called POTS, which might mean that when you have a bath, it's great at the time, but like me, when you stand up afterwards, you get really dizzy, your blood pressure drops, and it just makes you feel a little bit ill. So obviously, please do be careful. If you're not normally a bath person, just make sure that when you do try it, that you've got things in place in case you get a little bit wobbly. So again, that could be something that's really nice and warm. Or I know some people that have ice baths, which to me sounds absolutely horrific. But to some people, they swear by it. It's the only thing that helps reduce their pain. Stick a bunch of ice in the bath and get in it. So obviously, whichever works best for you. You might put some Epsom salts in your bath. Some people swear by that. Just to help the muscles relax, which is nice. And again, some things that do involve money. So I know that obviously not everyone is in a fortunate position to be able to have money to spend. However, heat-wise, you could go to things like a sauna, a steam room. Some people are better in dry heat, people are better in wet heat, with that humidity. I'm better in dry, so I prefer a sauna over a steam room. These are all things that you'll kind of learn over the years once you kind of get used to what your body's telling you. Hot tubs are great. I love a good hot tub. On the rare occasion I can find one and get in one. My physio place has one, which is just amazing. And then obviously the jets in the hot tub help massage and relax my muscles as well, so hot tub's great. And then the cold version of that is something called cryotherapy. So cryotherapy is when you are in a container that goes down to minus 180 degrees and it's very, very cold. But again, obviously I am aware that costs a lot of money, so that completely depends on your situation. I tried cryotherapy because I'm one of those people, if someone suggests something, I'll give it a go, because I almost have this fear that the one thing that I don't try will be the thing that helps me the most. I don't know why. Cold makes me horrendous, so I don't know why I thought going really, really cold would help, but you never know. And yeah, I can see how it helps if cold is your thing. I was alright at the time, but again, 24 hours later, I knew that I'd made the wrong decision. Minus 180 degrees is as cold as you think it is, so definitely make sure that you are a cold person if you try that one. So yeah, hot and cold, that would be my next tip in trying to figure out what works best for you. Okay, number 6 is a very short one, and it's alcohol. Not as in drink lots of alcohol if you're in pain. That's not what I'm saying at all. I'm actually saying the opposite. What you might find, and it's one of those things you don't necessarily know until you pay attention, is that if you drink alcohol the night before, you might be in more pain the next morning. So it might just be something that you can pick up on and figure out for yourself and decide what you want to do. Sometimes you don't really realise that's what it's doing because it might be hard to differentiate between that and a hangover. However, once I started deliberately kind of thinking about it and taking note, I did realise that actually alcohol did have a bit of a pain effect on me the next morning. Doesn't mean you have to go completely sober, completely dry. Obviously, that's within your own decisions to make. It's just a thought that maybe you're unaware that it is affecting, obviously, your pain. So that was just a quick short one. Okay, number 7 is, what shall I do? TENS machines. So a TENS machine is something that a lot of people have. So you get a little, it's normally about the size of your phone actually, and you can get a little boxy thing. And then what you do is you attach pads to part of your body, and it sends like electromagnetic pulses. I think it's electromagnetic. Anyway, it sends pulses down and through your body, helping again to just relax the muscles. I love my TENS machine. You can get, there's so many different types out there, so I would 100% recommend doing your research, finding out which one works best for you. You have ones which might have like 2 stickers. My one has 4, and my one has way too many settings. It's like there's 6 different options, all of which have 4 options in the options. So that's like 24 different type of pulses. So you don't need to get anything that complicated if you don't want to. But it's just an idea. Again, versions of TENS machines are like vibrating things that you put your feet on. Quite often they are targeted when they're advertised to the more elderly people in the community. Doesn't mean you can't use them if you're young. If it helps you, it helps you. Forget the stigma. If it helps, basically. So again, using the TENS machines, again, it's more focusing on relaxing the muscles more than anything. So have a look at the TENS machines. Something very similar to the TENS machines, which I've seen advertised but I personally have not used, but I know some people use, is these things called pain relief pens. So it's like an injection. I think it's based very similar to acupuncture. It's like based on putting and applying pressure to specific trigger points in your body. So I know they're advertised on the internet, so obviously you can have a look at them. Now, I haven't got much left, I promise, not in the non-medication part, so bear with me. I'm definitely going to have to split this into 2 videos, medicine and non-medicine, because this is way too long for one video. So my next one is going to be meditation. Now, meditation is quite often either your thing or it's not. When I first was introduced to meditation, I was 16, I was at one of these group therapy sessions, and I was lying on the floor, and I was like, what am I doing? This is the most pointless thing I've ever done. I'm just lying on the floor with my eyes shut, trying to think about not thinking. However, it's something I stuck with and persevered, partly because I didn't have much else to do when you're lying in bed. You're kind of limited. However, now it's something that I really enjoy and something that just allows me to almost accept my body and accept the pain, and how focusing on my body and my breathing and just calming things down kind of helps take things by moment and kind of takes that kind of panic and that overwhelming sense of pain and just kind of gives you a minute to step back and stop and relax. So I do recommend meditation. You can start by, there's loads of free videos on things like YouTube, there's meditation on Spotify. I personally like the body scan, so it goes through parts of your body, so you focus on your toes and your feet and then you work your way up your body. Some are just breathing ones, some you can do while walking, so you have like walking meditations. I just recommend that you give it a go, really, and then you'll decide pretty quickly if it's something you want to pursue or not. It's not for everyone, so I completely understand that, but maybe just give that a go. Next on the list is joint supports and compressions. So I have more joint supports than I know what to do with. So I've got knee supports, I've got wrist supports, I've got ankle supports, I've got what they call the SI joint supports for my hips, because I went through a phase where my hips decided that they didn't always want to stay in their socket, which is a little frustrating at times. And sometimes if you are doing your physio or you're going out and about, you maybe just want that extra security, extra support, to kind of have that confidence in your joint, and then hopefully that can, you know, the less stress on the muscles around the joint because it's got that extra support, hopefully will reduce your pain. Compression, again, people find compression really helpful. Either just the sensation of it being compressed and it being more secure helps reduce pain, or yeah, so just working with things like that. Obviously you get compression socks if you fly and if you travel. I'm going to do a completely different video on travelling with heads as well. So yeah, just giving it a go. Either you have one particularly annoying joint that is just giving you so much hassle, or you know, a physio might recommend it. I would say that you don't want to be stuck using your supports all the time, because your supports will start doing the job for your muscles. So your muscles may potentially weaken even further because they're not having to do the job, if that makes sense. So, you know, just bear in mind this is something you might want to do alongside kind of a doctor watching it, or physio advice or something like that. So just bear that in mind. You also get splints, so you get like ring splints, so for your fingers. I personally have jaw splints because I have a lot of issues with my jaw, grinding teeth especially, and basically my jaws have just decided that they like to have a bit of a dance about. According to my dentist, I now wear supports and splints in my mouth to keep them where they should be. So again, it's just kind of going online, having a look, seeing your options and seeing what works best for you. Second to last one, we're nearly there, I promise. My second to last one is mobility aids. Now I'm also going to do another video on of heads and identifying as disabled and what that means, and whether it be your internalized ableism or just coming to terms with that you might need a mobility aid. Obviously there is absolutely nothing wrong with needing a mobility aid. There are not set rules for when you can and cannot use mobility aids. This is something that I feel quite strongly about, and for years I didn't want to identify a certain way. I didn't want to identify as disabled. I didn't want to be the schoolgirl in the wheelchair. And then I had a really lovely teacher at college actually, and we were going on a foreign trip, and she was very polite and opened my eyes to basically using a wheelchair the entire trip. And I am so thankful that she kind of pushed me towards it and helped me embrace my disability and let go of the stigma that I personally had around using a mobility aid despite being a teenager. Because again, it doesn't mean that you can't do something. It might just make it easier and less painful to do it. You know, if you're going to the park with the kids and, you know, for years you've been struggling, you know, you walk there, you stand, you walk back, and it's got to a point where you don't know whether you want to keep doing it. As much as you love spending time with your kids, it just takes so much out of you. Well, maybe on your Saturday trips to the park, you go in a wheelchair. And then you'll be surprised maybe how much less pain you're in, and it just makes you able to do and see a lot more options. So obviously, you know, considering maybe mobility aids is something that you might want to use surrounding pain relief, doesn't make you weak at all. In my opinion, it actually makes you strong to embrace and acknowledge what you need help with, and to go on from there. I personally think that makes you a very strong person to be able to do that and ignore, unfortunately, what is quite often a big stigma and other people kind of looking at you, especially if you're young. But I'm going to do a whole other video on that because it's something I quite passionately believe in. So pain relief, mobility aids, just think about it. You know, you don't have to decide right here, right now. Just maybe consider if it's something that you want to use. Finally, the last non-medication option. This is going to be quite short because there are lots of people that are experts in this that you would definitely go to talk to you about information. I'm not one of those people. And that is CBD or medical marijuana. Again, this massively will depend on the legal status in your country, in your state. If you're in America, I know it differs from state to state. What I will say is when you classify things as CBD or medical marijuana, CBD is often legal, whereas medical marijuana is not, because CBD lotions and things like that have something called THC removed. The THC is the thing in marijuana that makes you high, basically, and that's removed. So even though medical marijuana is at the moment still illegal in the UK, apart from in exceptional circumstances, but obviously we all know there are complications around that, CBD itself actually will be legal as long as the amount of THC is below a certain level. So don't think automatically that things like CBD are ruled out. It's certainly something to look into. And then obviously on top of that, you've got medical marijuana that includes THC. Again, obviously, please stick to the laws where you are. I'm absolutely not advocating breaking the law, that would be irresponsible. A lot of people use medical marijuana instead of drugs, and there are some wonderful stories of people that it's helped massively. I personally am allergic to marijuana, as I said, so probably not going to go very well for me. But again, it's something maybe just to look into and do your own research about. So finally, that is the non-medication section of my video on pain relief. So I hope you've had some ideas, you've thought about some things, you've maybe learnt some things that you could try, and I really hope this helps some people. That is my primary reason for doing these videos, is that people get help that they need. So thank you.